Good to see everybody back at Einstein's Eyes, our YouTube channel. I'm Carl Rosen, your co-host, Oculoplastics, Neuro-Ophthalmology in Anchorage, Alaska. My friend and co-host, Jon Ditkoff, is here. We both trained at Albert Einstein. And John?
Hi, everyone. Yeah, I'm a general ophthalmologist specializing in cornea. I've been in New Jersey for about 31 years. And it's nice to see Carl once a week when we do this YouTube video. So welcome.
We're going to talk about a fascinating case report out of the University of Maryland Medical Center. A world first surgery where neurosurgeons removed a spinal tumor through the orbit. That's right, through the eye socket. So these are the group of surgeons, neurosurgeons at the University of Maryland. This is a representation of where the tumor was. I saw this headline, I had to do a double check. I got whiplash because a spinal tumor removed through the orbit is just not the standard playbook move. I've been an orbital surgeon for 31 years. I trained with Jack Hennardell in Pittsburgh, and we never did anything like this. And we also worked closely with neurosurgery. And Joe Maroon was the neurosurgeon at Allegheny General, where I was at. Very busy neurosurgical department. And I assisted on many, many cases with neurosurgery. Traditionally, tumors in that location at the skull base, which is the base where the brain sits, or the upper spine, again, this is the skull base area, here's the upper spine, are approached from the back of the head or neck. And these surgeries can be very invasive with big incisions and major risks. So what's groundbreaking here is that the neurosurgical team realized that the orbit or the eye socket could be used as a corridor to reach the tumor safely. As orbital surgeons, we know the orbit isn't just a container for the eye. It's actually a potential pathway to deeper structures in the skull base. And we use the orbit through, sometimes you can go through the nose, you can go through the superior orbit, you can do a craniotomy, you can get to the roof of the orbit. There are different pathways to approach tumors within the orbit or within the anterior cranial fossa and also the skull base just above the orbital roof. We do something called lateral orbitotomy, where you can remove the lateral wall, this wall here, with something called osteotomies to cut the bone away, the lateral orbital wall or zygoma, and get into the orbit that way. There are other ways that you can approach the orbit, but you have to be precise and you have to navigate around the optic nerve. You don't want vision loss. You have to watch the eye muscles. There's the lateral rectus, the superior levator complex, the medial rectus, the inferior rectus, and then the obliques, the superior and inferior oblique. If you damage those inadvertently, you can have double vision, and double vision that can remain with the patient, which is very, very troublesome. But with advanced imaging, guided navigation, and modern surgical tools, the orbit can become a safe passageway to areas that are usually inaccessible without, as I mentioned, massive surgery. There is risk involved, and make no mistake, you can damage vision, you can damage eye movement, you can damage the eye. But in this case, the team successfully used that narrow corridor to remove a spinal tumor, and the patient came out with vision intact and the tumor gone. And that's remarkable. Here's a diagram of the approach through the medial inferior orbit and through the nasal cavity to the spinal tumor. As an orbital surgeon, this shows how critical orbital expertise can be with these multidisciplinary cases. It highlights just how collaboration between ophthalmology and neurosurgery opens up new frontiers in patient care. So to sum up, this is a first of its kind surgery, a tumor removed through the eye socket, and a great example of innovation in medicine. But as a reminder, this is not without risk. The orbit is a gateway to deeper structures, and this could change how we approach certain skull base and spine tumors in the future. John, any comments?
Yeah, so I came across this article and I was just blown away. As Carl knows, this is his wheelhouse. I mean, I haven't done an orbit case in over 30 years. I haven't been near, I try to avoid orbits as much as I can as an anterior segment surgeon. But yeah, the anatomy is incredible. And as Carl brought up, it's a novel approach. I mean, it's anything that's done that might offer some innovative approach. I mean, I guess the big advantage is, as they mentioned in the article, is the decrease disfigurement, scar tissue, et cetera, Maybe it's more elegant and more, they can visualize it better. But as you brought out, I mean, we generally try to avoid the orbit. So they're going in the orbit, and that does pose some risk to us as eye doctors. But I guess anytime they go through the nose or anywhere else, there's always going to be risk. I did reach out to a neurosurgeon that I'm very close with, and he was really intrigued. He said, he wants to see more information and videos and anything else that's been done. And I think it's just amazing. 2025, the advancements we see in medicine, and it's just very exciting. So we hope you guys enjoyed the video, and any questions, reach out.
Thanks, John. Thank you, everyone, for showing up to Einstein's Eyes, and we will see you on the next one.